All right, guys, welcome back to another episode of the Performance Rehab Authority podcast. We have Dr. Katie DaBrowski on with us today. Katie, thanks for coming here and joining us.
Happy to be here. Yes.
Katie is a physical therapist. She is a strength coach. She wears a lot of hats. She's also the co-owner of Old Bull Athletics, the director of Gifted Academics, and she's neuroscience faculty at Nova Southeastern, not Southwestern, University in Florida, where she's helping mold the minds of students. So you could say she's a little bit busy. So thanks for taking the time out of your busy schedule to chat with us.
Yeah, of course. Happy to be here. I love everything that you guys do. So I know this is going to be a fun chat.
Yeah, I'm really looking forward to it. So let's just hop right in. I'm always interested. Well, one, it's clear that you have a large role in education. And before this, we were talking about mentoring and mentorship. It's clear that's something that you're passionate about. So what would you say is the biggest deficit that you see in the industry for rehab?
I think I could kind of separate these things twofold. I think we have deficits on the side of patient care, but I think what people often don't talk about are the deficits on the side of the provider as well, and the type of care a provider receives. I think that the mission at Old Bull, for example, is to give people a healthcare experience that they didn't even know was possible. And I think that aligns with not only for the patient, but also for the provider. From the patient side of it, I think one of our biggest misunderstandings and problems in rehab is the significant underdosing of how we're actually giving people a stimulus or lack thereof to create change, to create adaptation. I think that's a huge deficit in just what our jobs are and understanding how much we can actually push people to make change. And also just what the general public's perception of physical therapy is. Most people don't even really think it's about making a change. They think it's about laying on a table. And I think that's a huge area of opportunity for these newer generation clinics and newer generation practitioners to completely change. It's changing a lot, even from when I was in PT school, which wasn't that long ago. It's already very different. So I think that's a huge part of it. And then on the other end of the spectrum, I really think a huge problem in our industry is that just providers don't have a type of work environment that they're fired up about and that they feel like they're actually making a change. You have people who all we want to do is help people. But when you're in a setting where you're overworked, you're burnt out, and your plan of care is dictated by somebody behind a computer screen who doesn't have a medical degree, telling you if you're getting reimbursed or not, I think that really changes how people feel as a provider. We often feel that our degrees don't even matter because we're not actually getting to do what we want to do with patients. So I think it's across the board, patient expectation and experience as well as provider.
I think that was a very well articulated answer.
Thank you.
I think you're right. A big part of the problem is the environment that people work in, right? And when you are a new grad and you're fired up about getting out there and helping people, and then you go and you work in this mill clinic, that's what I did. I ended up working in a clinic where the expectation was to see 4 people an hour, and they would all come at the same time. So it's not like every 15 minutes.
Insane.
4 people come in at the same time. Yeah. And we had a 30% expected cancel rate, so they would overbook. It's ridiculous, right? So then you get in a position where you really can't help anybody because you're just running around putting out fires the whole day, and then you're also working in a system in a clinic where everybody there's been doing that for 10 years, 15 years, and they're burnt out and they don't care, right?
Yeah,
that is a huge problem because when you come out and you want to give good care, and you're in an environment where the standard is much lower because people are burnt out and they're not passionate. And they lose they forget that people are there relying on them, right? To solve their problems, help them out of pain. You have the opportunity to drastically improve somebody's life, but they just run through the system,
Yeah, even the most well-intentioned therapist, it's going to be really hard to put your best foot forward every day when you come into a setting that the patient doesn't want to be there, and then the people that are supposed to be, as a new grad, maybe your mentors or the people that you look up to, they don't want to be there either. And I don't think it starts out as anybody's fault. It's more of the system being to blame. And I always talk about that carefully with people because not everybody has the luxury to go to a one-on-one cash-based setting or work in an area where it's even an option. I think it's getting better with that too, because again, you can definitely make it work toward the population that you'd like to treat based on the demographic you have. But I think it's really hard to even say like, yeah, just make the most of it, because you get to a point where it's like, nobody wants to be here. How am I supposed to feel excited about this every day? And I think that's a huge issue. I think our profession, we work with people in arguably their most vulnerable moments when they're in pain. And that's really tough, and it's really depressing, and it's really hard. But I think if we don't have a little bit of lightness and fun in our environment, that just gets compounded. And I think what we try really hard to do at Old Bull, like, we're silly and we're weird and we have fun. And I think that's so important. There's nothing about either of our spaces that makes it feel like a sterile clinic when you walk in. Like, it doesn't feel like stuffy. It doesn't feel uncomfortable. It feels silly and fun and lighthearted. And I think that's really important too. I think when it comes to like professionalism, I think there's a way to be incredibly professional while also still having fun. And I think that gets lost in some of these clinics as well. Like, I want people on our team to know that they can just have fun all day. Like, that is, I think, what makes our job really cool.
Yeah, I mean, and it gives you a unique opportunity to build a real relationship with people, right? Like, versus their primary care that sees them for 15 minutes, or some specialists that they see, once or twice. We're spending a lot of time with people. So imagine putting yourself in that situation where you're going to like a stuffy office, a week, or, if it's an insurance driven world, like 2-3 times a week, it's like, they don't look forward to that. What kind of music do you guys play in the clinic?
Oh my gosh, a whole lot of things. Mostly, we're very passionate about Usher, so Usher Confessions is often playing. No, we play a huge range of music. We're definitely like an R&B and hip hop family for sure. But like, we're also all stuck in the early 2000s, so it's pretty hilarious that it's just like Ja Rule and DMX and Usher. And then like a kid will be coming in, so someone's like, switch it to Kygo Radio or like something that's very, very generic. But yeah, we play a lot of fun music, and we take requests. Like, we want our clients to have fun. Like, we want to see like what's going to get them excited. How are they going to have fun with a lift?
Yeah, so they enjoy their time there, and they like look forward. It sounds like your clients look forward to coming. Right? And
I sure hope so, because that's the mission. Absolutely. Like, we want people to realize that, first of all, the type of care that we're providing is accessible to everybody. Meaning, if you walk in our space and you see these huge squat racks and a kettlebell that goes up to 200 pounds and these like, heavy stuff, it can seem intimidating, and it might seem to somebody who's never lifted before like, ooh, is this for me? Part of our mission at Old Bull is to make every single person realize they're an athlete in whatever light that may be, and make people realize like, oh, I belong here too. Like, this isn't the type of care that's only reserved for a professional athlete. I want the everyday person to receive that same type of care and be in a facility that screams excellence, even if they think that they're not there yet. I think that's really important. So yeah, we want people to have fun. We want people to feel comfortable. Some of my favorite feedback that I've ever gotten was people who come in and say that they, just by looking at the gym at first, they would be worried that they wouldn't belong. But after their first session, they realize they absolutely do. And I think that's so important, especially in a place like Miami, where the fitness culture is very culty. It's very much about like showing off. And, I work with some of the most badass, like strongest people I've ever met. And they've never once made somebody feel uncomfortable. And I think that's huge too. Like, we want to open doors. We want to feel welcoming. And even though Frankie can overhead press 225 pounds for reps, he's not making anybody feel uncomfortable about it. It's more like, hell yeah, this is so fun. I can't believe I'm in this environment. I think that's so incredibly important in an industry where people feel like they don't belong, and we want to show them that they do.
Yeah, I think that's awesome. I'm sure it's very very cliquey in Miami.
Yes.
Yeah, I mean, just one more thing on that. Like, we have a clinic dog, right? And like, people they love it. They like look forward. If the dog's not here, it's either Ellie or Finn. We have 3 dogs, but Jasmine is a mouth-driven shepherd that barks at everybody. So we have Ellie and Finn. Ellie's a Bernedoodle. Finn's like an Australian cattle mix. And they're not here. People are like distraught. They're like upset. They're like, I'm ready to go home. There's no dog.
I brought my dog to work today, and I walked in. Everybody screamed Miko and said yay, and just didn't even acknowledge my presence. I was like, nobody's ever shouted yay when I walked into a room, but if I bring my dog, they absolutely will.
Oh, we'll have new patients that will walk. He'll be like standing right by the door. They'll walk in, say hi to the dog, not even acknowledge that
Yeah.
I exist. They're like, "Oh my god, I'm so sorry.
Right.
There's just a dog there."
Yes,
Okay,
we're big on gym dogs. So yes, agreed.
that's awesome. All right, so let's switch gears here for a little bit, because I know something that you're big on is talking about non-diagnosis driven care, right? How would you explain that to clinicians, and how does it compare like to the alternative?
Yeah, this is a topic I'm definitely passionate about. I think in school we go down the rabbit hole of on purpose, right? Because it makes sense for testing and for boards and things like that. So I'm not bashing it. I think it's still a necessary introductory phase of learning as a clinician. But we really go down this rabbit hole of having to know this very specific diagnosis for every single thing that we do with a person and going through like a laundry list of tests and measures to really basically the goal being at the end of the day that we've come up with this very specific diagnosis that translates to a very specific billing code. I think that when it comes to real life and the real world and understanding really when that matters and when it doesn't is super important. I'm always cautious with how I present this topic because it's not saying that a diagnosis never matters. And it's not saying that if it's what a client wants, that I'm just going to flippantly say no. But also, I think part of our job is to really understand that like in the absence of severe red flags and trauma and a very specific mechanism of injury, most pain and injury isn't something that can be explained by a structural diagnosis. Most pain and injury is this perfect storm of events of were you prepared for this activity? How's your stress? What does your training look like compared to the thing that you just tried to do? When's the last time you've done the thing that you've just tried to do? What are your attitudes and your beliefs about the exercise you just tried to do? It's so much more complex and convoluted than just saying, oh, this fiber of my rotator cuff has this type of strain and this specific injury and this specific diagnosis is warranted to explain what's going on. I think the sooner that we can get clinicians and also the person receiving care aware of that and not saying that their pain doesn't matter, but just understanding like how complex the pain experience and how normal it is for a human to experience pain. I think that's huge. Like I get people who come in and the second their knee hurts, they always say it's their meniscus. I'm like, how do you know it's your meniscus?
That's
We
funny
don't
because
even know that.
I just had the same thing. Like they think they tore their meniscus. Yeah.
Every time, every single time. And it's so funny that that's the immediate assumption because I think we've really been conditioned to think this very linear, if this, then this. If I have pain, then there must be something wrong. And I think part of our job really lies in helping people understand that pain is a normal human experience. Unless you just got hit by a truck, it's probably not this very particular injury that we have to be concerned of. And it's more about making you as a human more prepared to tolerate what you're trying to expose your body to.
Yeah, I think that makes total sense, and I'm I'm of a similar mindset, right? Like when I'm explaining things to patients, I'll never. I mean, again, if they want me to tell them, like I'll ask about their beliefs though, like, hey, why do you like? What makes you so interested in knowing like a very
Mm-hmm.
specific issue, right? Like I was just having this conversation, actually just before this with a registered nurse that came in for her first visit, and she's like, yeah, I think I'm going to get an EMG and I want to get an MRI too. I'm like, okay, you can if you want to, right?
Yeah.
But I'm just curious, you understand what is your desire behind getting that? She's like, well, I just want to know what's wrong. Right. And it's like, then we had the conversation around like, there's a high likelihood that there's nothing structurally wrong, right? Like, do you want to have surgery? Like, do you want to have somebody go in there and structurally make changes to your body? She's like, well, no. I'm like, all right, well, then don't look for something structurally to fix. And then
Yeah.
I'm always looking for like, what are the forces that you're sensitive to? Like, what are the mechanical stressors on the knee, on the elbow? Like, what are the forces? What are the positions, right? What are the movements, activities, situations that are stressing you to cause pain? And then, around it, above and below, to the middle, whatever, like, what is contributing that's maybe restricted and then contributing to that? Because, if someone's knee pain is rarely just a knee problem. It's a hip and an ankle and or
For sure.
so like getting people to see the big picture and just kind of explaining more of the overall like big picture view of what we've got to do versus going in there and saying like, oh, yeah, I think you have a meniscus tear. I think you have a herniated disc. It's like,
Yeah.
it's not helpful. And it's, it's for lack of a better word, no CBIC, right? Like people think
For sure.
disc, they think meniscus, and they just go surgery. So how do we
Yeah.
explain these to people in a way that empowers them to take control and ownership over the rehab versus for looking for a fix from somebody else, you know?
And therein lies the exact like mission. And I think what all of us in similar settings are trying to do, because I think it comes down to a lot more of like we're restructuring a person's understanding of healthcare. And that's really hard. It's not going to happen overnight. And I think that's a huge thing to be aware of as a clinician too. Like we're not going to change somebody's mind after one visit, but we can start to get them thinking in a different way. And I think that's really important. I think earlier in my career, I also might have been quicker to be really dismissive of anything that somebody wanted to do when I knew they didn't need imaging, instead of approaching it a little bit more cautiously and with the respect of like, okay, sometimes we have to remember we have the luxury of understanding how our bodies work. 99% of people do not, and it's scary to them. They feel pain and they're terrified. We are so fortunate that in our professions, we've spent decades learning about how our bodies work and knowing like most of the time we don't have to be scared when we feel pain. That is such a luxury and such an affordance that most people don't have. And I really try to ground myself on that when I can, when I'm working with somebody and it's like, all I want to do is shake them. But it's also like, no, this person has had 50 years of being told that bending over is bad for your spine. If you have pain, you need surgery. If there's something wrong, the only thing that you can do is take medication. And we have to be really, I think, respectful of somebody's paradigm shift happening. And also be understanding that like it might not always happen. And that doesn't mean we're bad at our jobs. It just means like you're one person trying to undo years of this person's healthcare experience. And that's really hard. So I think a lot of the conversation is often like what I will tell people a lot is, you know, one of the biggest parts of my job is to keep you safe. And not only for you, but also for me, because my license can get taken away. So my job every single time you come in is to make sure I'm ruling out the need for you to be seen by anybody else or for more imaging or more diagnostics to be done. I'm doing that every single time you walk in the room. If there's ever an opportunity that arises where it's deemed necessary for you to get some further evaluation, I'm absolutely going to tell you because that's my job and that's my license is on the line and your health and safety is on the line. And I think when you put that type of message behind it to show how diligently you're working every day toward making sure that red flags are never an issue. And if they are, you're going to send them in the right direction. Like people just want to feel safe. And I think that's a really important message to send.
Yeah, there's a lot of wisdom and experience talking right there. It's when I'm thinking about myself in a situation, I would call it for me a maturing as a therapist because I was
for sure
a young buck. I definitely like butt heads with people and was a lot more confrontational because I didn't understand. You know, I didn't understand their frame of reference, their thought process, where they are emotionally, like their journey, like you're describing. So being empathetic to that is huge, right? It's like understanding how they're feeling and then being able to structure the conversation skillfully around conveying the information in a way that builds confidence and trust in you in what you're doing. So I think that's awesome. So what's your take on rehab geared towards physiological adaptation, like we were talking about a minute ago, as opposed to like focusing on pain or structure to lead a session?
Yeah, I think that's like the hallmark of really our treatment paradigms at Old Bull. And I know it with a lot of colleagues like yourself and what you guys are doing in your facility. Definitely like at the end of the day, I think the highest level of evidence we have for anything that we can be doing is to try to create a physiological adaptation for change to occur. It's the paramount of training. It's literally the backbone of what training is and why people get better at training. So it's still always confusing to me that it's not the paramount of what rehab should be. But at the end of the day, rehab is training in the presence of injury, and we're still trying to make sure that we're reaching milestones of physiological adaptation and change. We're doing things that are actually moving the needle toward there being a change in the size of muscle and the strength of a muscle and the tolerance of a tendon and the springiness and elasticity of a tendon. Like everything that we should be doing should be geared toward that. And I think if you look through that lens, it starts to make the other stuff not matter as much. Like I think that's where you can also get away from the need for a diagnosis. If I have somebody with knee pain and I've ruled out any red flag scenarios, all I then need to do is make the knee a better knee. I need to make sure it can bend. I need to make sure it can straighten. I need to make sure the quads are strong, the hammies are strong, the surrounding structures are strong. I need to make sure it can absorb force, produce force, handle jumping, handle landing. I now know what to do with every single knee that walks in the door because that's the recipe. It doesn't matter if it's a ligament issue. It doesn't matter if it's a tendon issue. It doesn't matter if it's a muscle issue. It really matters that red flags are ruled out. The need for further diagnosis is ruled out, and we're just working on making the knee better. And that all comes down to physiology. Additionally, with that, like, I think a huge shift in my own career and my own way of navigating injury with people is, I think in school we're taught that, we're literally taught that pain is the fifth vital sign, that pain and understanding somebody's pain and how important the visual analog scale of 0 to 10 pain is, like, that's centered upon what our whole treatment is and our whole evaluation. And I think that actually sends a mixed signal. That sends a mixed signal to our patient of the only way you're getting better is if you have no pain anymore. And I don't know about you, but there's not a single day in my life where I don't experience an ache here or there, a pain here or there. And instead of normalizing pain as a part of the human experience, we're creating this completely unrealistic goal of never experiencing it again and only being better or healthy in the absence of it. And I think that's incorrect. I think part of our job is to also show people that it's okay to experience pain. It's part of the human experience. Our job is to not take it away because we're not magicians. Our job is to create a human so resilient that when pain does occur, you have the tools to navigate it. And I think that is where we miss the mark a ton, because every single time somebody walks in, 0 to 10, what's your pain today? 0 to 10, what's your pain today? How's your pain over the weekend? How's your pain? Did you have a flare up? Instead of, what did you do this weekend? What did you get to do that you couldn't do last weekend? What are things that you still want to do? And now we have an action plan to work on them together.
I'm laughing a little bit because I like totally forgot that's the thing that people do. They just walk in like, all right, 0 to 10. How's your pain?
Yep.
Yeah. I forgot that's a thing.
Yes, it totally is.
I was just talking to another client earlier that she's a runner, and she was just saying, like, I feel like I've always got some type of ache or pain. And I was like, yeah, like that's totally, like, I think my response,
you have
like,
a body.
Yeah, like that's totally normal. Like, when you have a body, you move it. And, we do have a little bit of a trade-off as athletes, right? We're not going to have type 2 diabetes, but we're going to have aches and pains related to using your body. It's a normal thing. She was like, yeah, no one's ever told me that before.
Yeah. I think giving permission to people, I think that's huge. Like, you touch on a really big topic there. I think part of our job is to also give permission to people for experiencing an ache and pain. We're so taught that, like, we're supposed to avoid it at all costs. I just don't think that's realistic. But the analogy I often use is, I can't stop you from walking out of my clinic and stubbing your toe. I'm never going to be able to do anything to bulletproof you against that. So, but what I can do is make you pretty strong. So if something does happen, maybe it doesn't hurt as much. Maybe it hurts, but it goes away faster. Maybe it hurts, but you can still do the thing you want to do. And I think shifting that is huge. It's not saying that we don't care about people's pain, but it's saying that it's an inevitable part of life. And we're more about creating like a super strong and resilient person to tolerate it, instead of being incorrect and saying that I'm a guru and I can take it all away. Like, that's just, that's out there. That's like 90% of rehab content on Instagram, but it's just not reality.
Yeah, totally. I hate that. Like, POV, you did this one exercise and your back pain magically disappeared. Like,
kill me now.
Getting clicks and views, but like, it drives like such a ridiculous narrative.
Yeah, absolutely.
I have a graph that I like to draw. I wish I had a whiteboard, but because people only feel like they're making recovery in the late stages, right? When they're down. And I'll draw just a graph with a pain line up top that goes flat and then drops off at the end, with the activity on the bottom coming out where the pain's the same. And I'll just draw a line before the pain starts. I'm like, when you're in this area here where the pain is the same and the activity is increasing with the same amount of pain, like, that is progress. Like, you are.
Yes.
And people don't know that. So, like, explaining that, and I find visuals very helpful. I also love analogies and metaphors, right? Because they explain things to people they can understand. You're talking medical jargon, it's like doesn't make sense to them. So how do you educate?
I love that.
The visual.
Yeah, I love that. No, very similarly, I got to get a whiteboard and start drawing some graphs. But very similarly, I think I talk a lot with people that exact topic of, our understanding of pain is really kind of muddy. And what we do know, though, is that, again, if we ruled out red flags, pain isn't something we have to be scared of. And it doesn't have to be something that causes alarm bells all of the time. And I look at progress in such a different way compared to only pain. And I'll explain that to people in the beginning. First of all, I'm looking at milestones instead of timelines, because I don't think people come in and the first question is like, okay, so when is this better? And they expect us to be like, oh, yes, 6 to 8 weeks, you'll be fine. I don't know. We know the general timeframes for tissue healing. We know that. However, that doesn't at all explain pain. We know that even more so now because of people with chronic pain who absolutely have healed tissues still have pain. So I'll explain the just like physiological timelines of generally speaking of tissue healing. And I'll also explain the general physiological timelines of noticing differences in strength beyond just neurological adaptation. And I'll use those as benchmarks. Like, we know that this type of tissue takes around this long to heal. We know that to make a change in the gym that you're going to notice, it takes around this time. We can use that information as an anchor point. However, for us, our progress is going to be more in the form of milestones. So I want to see, when can you do this jump again, instead of, okay, 3 weeks from now, where are you at? Because I don't really care if it took you 3 weeks or 8. I care that you can do the task that you need to do and you feel ready for it. So that part of the conversation is huge. And then, just like you were talking about, I talk a lot about understanding that pain is not the only definitive marker of progress. And I'll use examples of, as you said, being able to do a new or harder activity with the same level of pain, still progress. Getting a flare up, but it lasts 4 days instead of 12, progress. Having pain, but it's a 5 instead of a 9, progress. And I don't think people are really told this information because, again, they're taught pain or no pain, unhealthy or healthy. That's really the only information that they get. So I think it's a huge, another paradigm shift, and it's not perfect, and it takes time for people to warm up to. But I think that's very important for us to talk to our clients about.
Yeah, 100%. So then how do you educate your patients on pain, like with discomfort pain during an exercise? Because I know it's something that a lot of PTs are afraid of, like, oh, we can't have any exercises that cause any discomfort. So how do you explain things like that to your patient, or I know it's kind of context dependent, but
Yeah, it definitely is. Whenever I'm working with people, I'm trying to kind of in my head understand almost like a category to put them in. Are they somebody who is a catastrophizer and they're going to feel they have like a heightened experience of pain? Or are they somebody who's like a hard ass athlete who I have to tell them to stop as they're like actively limping? And people tend to be, not always on the extreme end, but somewhere toward they're more likely to be more fearful, or they're actually more likely to push through stuff that maybe they shouldn't. And I'm trying to understand that about my patient immediately. And that's going to dictate how I handle pain in a training session. Somebody who is a catastrophizer, just because I know them getting to a 4 out of 10 is safe, to them it's a 12 and they're terrified. So my idea of pain with them in a training session, I might be a little bit more conservative. If I have an athlete who's used to working through a 12 out of 10, like a true 12 out of 10, I might also change how I'm addressing pain in a training session. So that's kind of phase one of how I'm figuring out what to do. Then beyond that is, as I'm getting to know somebody better, I'm also going to see how they're responding to things. And I tell them that straight up. This is a little bit of a dance and I have to get to know you. Every time we have a flare up, it's a data point. It doesn't mean I'm doing things recklessly. It just means sometimes we're going to do something that's a little bit too much too soon. And I'm never going to do something that's dangerous. And I'm never going to do something that puts you in any sort of risk. However, if we do something that your body's not quite ready for, the response is going to be probably a flare up. And we're going to use that as a metric to understand for the future. All right, let's dial it back a little bit. And I'm always very honest and transparent with this because, again, I'm not a guru. I don't have every answer. And we're going to do things sometimes that I'm not going to push somebody enough. So we're not going to get really an adaptation, or I'm going to push them a little bit too far. And maybe that was too much for that day. So I also think just being comfortable with that, it takes a long time to get there, but also making your client comfortable with that. It's the same thing as somebody seeing a physician and they're trying to get a dosage for a medication and the dosage is too low and they don't feel anything. Nobody comes back and screams at the physician about it. They're like, hey, doc, I think I need more. Conversely, you give somebody too much medication, they have side effects. And it's very similar with exercise. If we can have a little bit more of a fluid understanding of there's going to be some I don't know, a little bit of a dance of how we figure out this is like the right balance and the right dosage for you. I think that's huge. And then kind of the phase three from that, my general rule of thumb, once I've taken all of those individual characteristics into consideration, I consider on that 0 to 10 scale, like 0 to 3 or 4, workable adaptation discomfort. Beyond that, don't love it, let's modify. I also consider if we're feeling decreased pain or the same pain while we're going through a session, cool. If every round it's ramping up, we should probably modify and pull back. And then the third line of that is if you feel discomfort after and it's lasting for more than 24 hours, that tells me maybe we need to dial it back as well. So I'm kind of going from more conceptual ideas of understanding the person, understanding how fluid the experience of exercise and pain is, and then having some like anchor points of those numbers to think of.
Yeah, I think taking essentially the psychographics of the person into context is huge, because I'm the same way. I tend to see a lot of people that, they're like, all right, 3 or 4 out of 10, and like, is good. Anything higher than that, like we want to, maybe make some modifications. And they're like, no, it's good. And you can like visually see that they're in pain. So those people
they're like grimacing. Yeah.
So with those people, I'll tell them like, hey, something like a 1 or a 2, because I know they're going to push it. If I tell them 1 or 2, up to a 4 or 5. If I tell them 3 or 4, they're like, more is better, And then on the other end, people that are very afraid, then maybe I'll say, hey, 4 or 5 is okay, because I know they're going to freak out. So I just, you just skew the scale, but it's really so important to get to know the patient. Like, and I love how you emphasize that, because it really is an individualized process. I agree with you on that for sure.
Especially because we've all had the client that you think in your head can tolerate more, and then they surprise you by what their pain response is. And I think like it's just so important to not have any preconceived notion of what that person is going to experience, and just go into it understanding that like our job, I think, is to also be really good in the moment of toggling up and toggling down anything that we have to do. And that's not only exercise selection of like progression, regression, or picking a new movement. It's also being able to, in real time, respond to somebody's feedback, whether it's verbal or not. If I see your facial expression change, I got to do something to modify. Like if you are grimacing, if you are like no longer breathing, if you're really tense, like even if maybe they're trying to impress you and they don't want to say they're in pain, like we have to be really, really just like experts of understanding nonverbal body language and communication. And I think that it's lost in a lot of times, and it's not really what we're taught in school. We're taught how to do every single special test, but we're not necessarily taught how to understand like, okay, what is the human in front of me conveying or desperately trying to convey to me?
Yeah. We're not taught that. We're not taught exercise, prescription, or progression at all. Like in my education, I had 0. Like I left school and I was like, so what kind of exercises am I supposed to use for people now?
Well, they don't even prioritize or make it sound like that's the brunt of your treatment. We're really made to think that skilled therapy is the manual therapy, and that the exercise stuff is just what you give a list of exercises to a tech to run through. And yeah, I mean, if it weren't for the fact that I was a trainer and an athlete, I would have been very lost as well, because I knew how to train myself. So I was like, well, don't I just have to do that? Like, I don't understand what the confusion is. Like, why aren't we getting this information? It's pretty wild.
I think that's the missing link for a lot of people, is that it blows my mind that people can go through PT school and like not develop a positive exercise habit. And I push myself hard in my training, right? Like, as you do as well. So you know what it feels like, right? And I know what it feels like to push, and I know how you can not want to keep going, but you can push, and that's where the real adaptations come from.
Yes.
And how sore I am, not all the time, but sometimes, right?
Yeah.
Like how hard I work. And people don't work that hard themselves. Like, yeah, there's a lot of people that go out and they kind of like leisurely exercise, or they'll jog, or they'll lift light weights, but they're not really pushing themselves to adaptation, right? We all know the person that's been going
for sure
15 years that still looks the same and lifts the same. And it's like there's been no progress because they're not driving adaptation. So unless somebody has that, I was talking to somebody in our mentorship program yesterday. Say Thursday or Friday? No, Wednesday. On Wednesday. Doesn't really matter.
Blur.
Yeah. But they were asking me, how do I continue to get better? Like, how do I continue to get better exercise prescription and knowing where to go and having more options? And I was like, you need you need a coach is what you need. Like you need a strength and conditioning coach programming for you. And then you can take the things that are in your program and you can use your
Yep.
brain and say, how does this fit in to rehab? Right. Cause that's where I've learned personally a lot of things. Cause I've done, I've trained a lot in CrossFit. I competed back when regionals were a thing on a team at regionals for a few years. I did some competitive powerlifting, some competitive weightlifting, done some bodybuilding, and I've done some jiu-jitsu. So it's just the athletic experience that I have from participating and having coaches telling me what to do, or I just take the knowledge and experience from other people and then modify it. Because like you said earlier, rehab is just training in the presence of an injury. So I think a lot of people could potentially benefit from just pushing themselves a lot harder physically.
100%. I mean, I think I get all of the time, and I'm sure you get this as well, like PT students kind of like DMing, being like, okay, what books do you recommend, or what certifications do you recommend to get into like the sports ortho world? What do you recommend to work in a cash practice? What do you recommend to do one-on-one? Like, how do you get to where you're at? And I always tell them, train yourself really hard, explore different types of training, have a coach write workouts for you so you understand what real program design is, and coach and train other people. I don't really recommend a book or a certification. It's more like you have to know what it feels like to distinguish between an RPE 4 and a 9. You have to know what it feels like. Like there's no other way. You
Yeah.
have to know how it feels when a weight is heavy and you're slowing down because you can't go at the same speed anymore. And you have to know that it's okay to feel your knees when you squat because you have 400 pounds on your back. Like you have to know that these things are okay. And I think that's a huge area. I think it's getting better because I do think things like social media are showing kind of our sides of physical therapy and rehab where people are drawn to it. And in general, people have more, I just think, like touch points on exercise and seeing it happen around them more. So I think that's an interesting positive from social media. I think it is helping move our profession in the right direction. But yeah, I mean, in PT school, it was startling the information we got on exercise. Our therapeutic exercise class was literally a open, like carpeted room with all of these bins of Bosu balls and AirX pads. And we were supposed to use that to come up with exercises for people. And everyone just stood there looking at each other like, what are we actually getting from standing on this thing? Like, how is this exercise prescription? So I think there's a huge lack of understanding.
Yeah, for sure. And I like what you said about like physiologically knowing what it feels like for RP 4 versus 9, because you'll have people that are in here and they're like, oh, this is so hard and it's heavy. But like you look at them and it's like,
They're chilling. Yeah.
We're going to work harder. You're like, hey, how's that feel? Like, oh, it's really heavy. And you're like, yeah, cool. We're going up.
We're doing 12 more reps here. So you're fine.
Yeah. A lot of clinicians go out and then they overcomplicate things or they end up questioning themselves early on in rehab, especially because of the things that they see on Instagram too. I'm curious, what are kind of the stages of rehab? Like, what does that look like for your patients? Like, what are they doing? Assuming someone's, an active adult that likes to lift weights.
Mm-hmm. Yeah, I think that's another huge like issue in the industry is really overcomplicating things. I also kind of think it's like a necessary phase that you have to go through to be able to come back around on the other side and be like, oh, it was this all along. But I do think you kind of have to go through that. Some of the biggest, like, I guess you could say like pillars of how we go through rehab with our patients at Old Bull. We're constantly trying to find like the maximum tolerable dose of their goal activity. So even in what people would maybe historically think of like phase 1 rehab, where it's lower level, you're restoring normal range of motion, normal strength, things like that. And again, I'm talking about like general aches and pains. This isn't like post-operatively. I'm not telling somebody in phase 1 ACL rehab to find their maximum tolerable dose of jogging. But for like kind of more generic ortho aches and pains stuff, if I have somebody who their goal activity is a squat, you better believe I'm finding whatever variation they can do right away of that. It might look nothing like a barbell back squat. It might be a super high 24-inch goblet box squat, but it's something that's their goal activity. And I do this for a lot of reasons. Mentally, to make their brain not scared of the goal activity that maybe got them hurt in the first place or is the thing that hurts the most. Also mentally, because typically when people get hurt, they think their athletic life is over and they're not going to ever be able to do this again. And then also for a physical adaptation too, of not getting so far away from the type of stress that we need to prepare their body for. So I kind of used to be in the camp of like, let's say somebody came in with pain with running. And I'd be like, okay, well, we're not running. We're only going to strengthen and we're going to build you back up over time to try running again. Now, if I have somebody who's a runner, again, in the absence of red flags to warrant not being able to run, I'm always very careful when I say that. But if I've identified that they're safe to run, they just have pain, I'm going to find how much they can tolerate so they can still do it. It might be a minute and then they might have to walk for 5 and do another minute, but at least I'm finding something to continue to expose their body to their goal activity and their brain and their mental health and like their identity that they've probably wrapped up in their thing that they do. You tell a runner not to run, they're going to go run and they're not going to come back to you. Yeah. So I think that's a hugely important thing. And then of course, beyond that, you know, the main like phases that we're looking for is trying to make sure that the muscles around a joint are very strong to be able to do to protect the joint, to be able to absorb the force. And we're also making sure for every single person that they can produce force and absorb force. So there's plyometric activity involved in everything. So we're making sure that people can tolerate those things as well. And then also like toward the tail end, like you do CrossFit, when I have CrossFitters come in, their graduation day is a wad from hell that I've created. And I want to make sure that yes, in a very controlled environment, they can do an overhead press. Okay, cool. Can you do a wall walk and then a wall ball and then go and do burpees and then do some cleans? Like I need to know that you can do what you're getting back to. So it's really, as you've noticed with this too, it's all centered on function and physiological adaptation, not really a conversation of pain unless it's dangerous pain.
That's finding like, okay, what's your goal? How do we keep you doing that throughout rehab on whatever level we possibly can, and then just progress. And it's the same thing. Like when I'm explaining what a plan of care looks like, I'm like, and in this last phase, you're going to be in here doing just hard looking gym workouts. So you're going to be working your ass off. We're going to probably be getting you on the assault bike and jacking your heart rate up and then having you do whatever it is, X, Y, and Z, fill in the blank. We're going to be fast. We're going to be getting you sweating, and you're probably going to want to bring a change of clothes.
Yeah, exactly. Yeah. And I don't think people are used to that. I also think people are used to going to a rehab provider or a physician and being told to stop doing things. And I think what I noticed just this like sigh of relief when I have a runner and I'm not telling them not to run anymore. I'm giving them guidelines on how we should approach running, but I'm not telling them it's off the table. And I think that's another huge part of it too. Like we take people, every time we tell somebody they can't do something, you're taking away a part of their identity. And you're also contributing to the bigger picture of this like huge physical inactivity crisis that we have. Like 75% of Americans don't meet physical activity guidelines. Why am I telling people to stop? Why would I ever tell somebody to stop doing an activity unless it was so dangerous that it would be irresponsible for them to continue? But I'm sorry, good luck finding what that activity would be, because as you said earlier too, like the risks of inactivity far outweigh any ache or pain you could get from being physically active. Howard Lux is an orthopedic surgeon who says that exact quote, like an orthopedic surgeon who's telling people like, move more. You don't need to be so concerned all of the time. I just think that's so important. And if also part of our mission is to make people have a body that's resilient to tolerate the impacts and demands placed upon it, if I take away the thing that is the demand for rehab, and then at the end, they're supposed to just go back and do it again, like I've missed the mark entirely. And I think that's, it seems really obvious, but it happens all the time.
Yeah. No, that's very well said. And if for some reason I was gonna take somebody's running away or whatever, which I don't, but if I did, for whatever reason I might have to, like it's like, all right, cool, got an assault bike, right? Got a rowing machine. Like we're gonna find some other stimulus to get that.
Yeah, don't worry, we'll still make this terrible for you. Like we got you.
Yeah. So I know we only have a few minutes left here, so I want to dig into you a little bit. Personally, like what's your favorite part about what you're able to do, like as a PT with your platform, as a teacher, like what really gets you going? Like what are you passionate about?
Ooh, that's fun. A lot of things. I think a huge thing is that like aha moment when somebody realizes that exercise is for them too. I think just like we're lucky that in our professions, it's afforded us the ability to understand the intricacies of the human body and pain and approach life, I think, very differently than the average person. We're also people, I think, who are naturally drawn to exercise. And sometimes I just feel lucky that I like to train and I like to run and I like to be active. Not everybody does. And it sometimes feels like a club that you don't have access to if you're not that person. And I think it's heartbreaking because the thing that is the best for your body feels like this exclusive membership if you're not fit enough or if you don't like it enough. And I think what I've become really passionate about is helping people from all backgrounds, not just somebody who's lucky to enjoy exercise, realize that they can fall in love with it too, and realize that there's a space for them too. I love that. And I feel that really passionately about women, especially as I'm getting older, and like with women who for a long period of their life thought that they had to eat less and shrink, and learning that no, you don't have to. Like, there's a place for you to be a badass, strong person, and you don't need to minimize yourself. You can actually take up space. I really enjoy that. And I think it's so exciting to see a paradigm shift in that direction and to maybe be a small part of that happening for somebody. I think it's really, really cool.
That is awesome. That is awesome. Overall, like, as a human, what's the impact you want to have, right? Like, on your community, the industry, your patients, like, what's your vision?
Hmm. Overall, I think I want people to have a better understanding of how their body works so they're less scared of it. I think that just like education helps with so much. Like, if you're scared of flying, learn a little bit about how an airplane works. Probably makes you feel better. If you are scared of every ache and pain, learn a little bit more of how your body works. I think that we have such an opportunity to help people understand just like what being a human is, and also like humanize the experience of pain and struggle and activity and all of these different things. Like, I think that is something that on a much bigger picture, I think overarching theme, I'm really passionate about and hope to make an impact for. And then giving people like a positive experience with movement. One of my greatest mentors, his name's Craig Liebenson. He's a chiropractor who's really reformed the idea of what people think of chiropractic care. And I don't think he ever puts his hands on people. He's very movement based. And he always says that, like, give people a positive experience with movement. If we do nothing else, have people realize that exercise is not dangerous and it's the thing that's going to change your life for the better. Like, make it fun, make it light, make it silly, give them something positive that they've learned from moving. I think that's a huge goal as well.
Yeah, I'd say you're doing a great job.
Thank you. I hope so.
I mean, I know just for me personally, physical activity is like when I'm doing well with my fitness, like the rest of my life is better, right? Like I'm a
Yeah.
happier human, I'm a better dad, I'm a better clinician, I'm a better partner, business owner, like literally everything. And when you're as busy as you and I are, like it's an easy thing to let fall. That's why I have a coach for the accountability too. Well, that not so much.
Same. I have one too.
Yeah, like because at the end of a long day or getting up early, and I'm like, oh man, this is one more thing for me to do, even though I love it. It's like, oh nope, someone's making sure I'm doing it, and then
Yep.
I always feel better afterwards.
Every single time. Yeah. I think that's huge. I think it's also another important point is to like let people know that even us who are in the industry and we live and breathe fitness, it's still hard. It's still something that I have to make sure I get done. And it's like I have days where I'm amped and so excited to train, and I have days where I'm exhausted. And I think that's an important message too. Like, we don't have it all figured out either. I think that also just shows you how just very convoluted the human experience with exercise is. Because if it's hard for us to do it and it's our literal jobs, I think that gives people a little bit of grace of why it's so hard to create an exercise routine that you follow. And it doesn't mean you suck. It doesn't mean you're lazy. It doesn't mean you're broken. It means you're a human being and this stuff is hard. So if you can find a way to do it that you love, if you can find a way that's fun, that's half the battle. And then the consistency over time, which isn't always going to be perfect, but that's how you accomplish it.
Hell yeah! All right, so over like the last 50 or so minutes, we covered a lot, right? From like
We covered a lot. We went through our list very well. I'm very proud of us.
yeah, it was good. So we've talked like clinical pearls, areas the industry can grow, the ways that you've personally been influencing it as a clinician, business owner. Is there any one thing that you want the performance rehab community to take away from this podcast?
This is such an overwhelmingly large question to ask. One
Look at
thing,
people on the spot.
one
She's not
thing.
prepared for this at all, guys. She doesn't
I
like me.
know. Um, I would say that I think a huge thing to remember is how cool our job is. No matter how stressed we are, no matter if we're in a setting that we don't love, no matter how tired we are, how cool is it that we have a job that does not require us to sit at a computer all day? And we get to meet people from every single profession, walk of life, cultural background, ethnicity. Like we get to interact all day, every day with people that we get to learn from and people that we get to make a slight positive impact on. For a lot of people, I think we have to remember you might be the only time during that day that they get a moment for themselves, that they're doing something for them instead of for somebody else. And I think that is such a huge responsibility in a good way, where that we should be really grateful for that. People are trusting us with their care. They're trusting us with vulnerable moments. They're coming to us and confiding in us in things that they might not tell anybody else in their life. And I think no matter if you're in a setting that you really are not happy in, like that can be your anchor point for a tough day. It's my anchor point every single day. It's my anchor point when I'm exhausted, and it'd be really easy to mail in a session and make it something that I don't have to think about. But I remember very quickly, this person has elected to take an hour out of their day to spend it with me. Like, that's so cool. Like, that's incredible. I don't think many professions get that. I don't think many people really do that in their day-to-day life. So I think if you take nothing else from the a million topics that we covered today, remember how lucky we are to have this job and remember how cool it is to impact people in the way that we do.
Yeah. Yeah, that's awesome. What's the best place for people to find you if they are like, damn, Katie's a shit. I want to follow her.
Instagram is always the best. My Instagram and our Old Bull Instagrams. I think those are the best places to do it. And you probably link those in here, but KT DaBrowski and then Old Bull Athletics. Those are both of our Instagrams. If if people have questions or want to chat, like shoot me a DM. Would be happy to. I love talking to people in this industry, so happy to help in any way that I can.
Yeah, awesome. Well, Katie, this has been absolutely fantastic, and it's going to be a huge value add for the community. So thanks again for taking the time out of your very busy schedule to chat.
Yeah, same to you. I know we both wear many hats between the two of us, but this is a lot of fun, and thank you for having me.